Dear students, welcome for the ENT segment. Myself, Dr. Deepak, will be discussing all these MCQs. Let us start with the first one. Which of the following is a true sequence of auditory pathway? Very basic integrated MCQ of your anatomy, physio, ENT. So what is the auditory pathway? That is retrocochlear compartment. So what is the retrocochlear compartment? Beta? ECOLI. And which are the two highest center? Two highest centers are MA, medial geniculate body, and auditory cortex. So let us revise beta. E for eighth now, C for cochlear nuclei, O for olivary, L for lateral lemniscus, I for inferior colliculus. So this is the auditory pathway for the retrocochlear segment, followed by MA, medial geniculate body, auditory cortex. Clear? So let us learn how to rule out the option. The first choice I am giving you, superior olivary nuclei. Superior olivary nuclei, that is option C, the third milestone. It is next to cochlear nucleus. It cannot be before cochlear nucleus. Option A ruled out. What about option B? Cochlear nucleus, followed by superior olivary, followed by lateral lemniscus, followed by inferior colliculus. Absolutely right. So the option B seems to be the true order of auditory pathway. Why option C is false option? Inferior colliculi. Inferior colliculus is a fifth center. It cannot be the first one. So I can rule out the option. And option D, lateral lemniscus, is not before cochlear nuclei. Cochlear nucleus is before lateral lemniscus. So let us revise again with a ECOLI, 8 nerve, cochlear nucleus, olivary, followed by lateral lemniscus, inferior colliculus. And we have last two centers, that is your medial geniculate body and auditory cortex. Now, investigation of choice. Where we are working in retrocochlear lesion. We are working in neural deafness. So what is the important investigation of choice for these areas? It is your BERA, Bara brainstem evoke response audiometry. While for the higher centers, this area, MA, medial geniculate body, we do CERA, CERA, cortical evoke response audiometry. So for the first five centers, ECOLI, we are using BERA, investigation of choice, expected MCQ. And let us use this MCQ for learning few one-liner MCQs. Like here, what is the investigation of choice for conductive deafness? It will be your impedance audiometry. Investigation of choice for sensory deafness will be your electrocochleography. And for neural, we'll be having BERA and CERA. Clear? Done. Coming on the next one. Question number 2, very favorite question of your FMGE. Examiner, aspiration in the respiratory tract is prevented by supraglottis and cuff reflux. These refluxes are sluggish in alcoholic patient. Which of the following nerve is commonly injured? Now let us learn the basic orientation of larynx. Main function of larynx, always remember, is protection. That is supraglottis. Supraglottic is responsible for the protection. What about the nerve fibers? Recurrent laryngeal nerve is a mixed fiber. It is supplying your four muscles along with the area below the vocal cord. A superior laryngeal nerve having two branches, that is external, internal. External is the motor fiber. It is supplying your cricothyroid. It is motor, while the internal is the sensory fiber. Internal branch of superior laryngeal nerve is supplying your area above the vocal cord. It is responsible for your protection. It protects you from aspiration. So which is a safety nerve of the larynx? Just remember, safety nerve of the larynx is your internal branch of superior laryngeal nerve. Option B is there. So this is a errata in the MCQ. Option B is the right choice. Always remember this. Question number 2, option B is the right choice. Question number 3, again image based basic MCQ. But if you go with the important drainage of the nasal cavity, paranasal sinus into the nasal cavity, what is the golden rule? We have 6 sinus. Out of 6 paranasal sinus, 4 sinus are opening in the middle meatus. Which 4? Maxillary, frontal, anterior ethmoid, middle ethmoid. What about the posterior ethmoid? Posterior ethmoid open in the superior meatus. And sphenoid sinus, it is opening in the supreme meatus. And what I'm showing you sphenoid bone, most posterior superior. Just focus your eyes on the slide, most posterior superior. So most posterior superior is here sphenoid. So examiner is asking you, sphenoid sinus is draining into. So sphenoid sinus will be draining into sphenoethmoidal recess. It will be draining into sphenoethmoidal recess. Let us Revise all the important point. Option A, inferior meatus. Inferior meatus will be the right answer for nasolacrimal duct. Then middle meatus. Middle meatus will be the right answer for four important sinus. Revise with me. Maxillary, frontal, anteethmoid, middle ethmoid. Superior meatus will be for posterior ethmoid and sphenoethmoidal recess, which is the other name. Always remember, sphenoethmoidal recess is the other name for supreme meatus. So answer will be here D option. So option D is the best choice. Answer will be D option in this MCQ. Clear? Coming to the next one. Again, very favorite, often repeated MCQ in FMGE examination, a trumpet player. Trumpet player, ENT MCQ, no need of reading the MCQ. Directly jump on laryngoscele beta. This is a air-filled cavity. Air-filled cavity in the anterior wall of supraglottis. Commonly seen in which patient? Trumpet player. Those who are doing excessive Valsalva. What is laryngoscele? The most probable diagnosis in this patient will be option C. What is laryngoscele? Laryngoscele is a large secular cyst. Large secular cyst. So if in a normal larynx, now if we examine a normal larynx, there is a saccule. What is saccule? Saccule is a oil tank of the larynx. It is present in the anterior part of supraglottis and it is responsible for lubrication of the vocal cord. So once it is blocked and it get enlarged because of air in the saccule cyst, we call it as laryngoscele. Treatment of choice will be a surgical excision in this patient. Clear? It is a supraglottic swelling. One more MCQ they can ask you. Which membrane it rupture? So just remember, it rupture thyroid membrane. Revise with me. Trumpet player, thyroid membrane related with laryngoscele. So air-filled cavity which rupture thyroid membrane. Revise this point. It rupture the thyroid membrane. It come in the neck. We call it as extrinsic laryngoscele. We use a word extrinsic laryngoscele. Intrinsic within the thyroid membrane. Extrinsic outside the thyroid membrane. So it rupture the thyroid membrane. It become extrinsic. It become extrinsic. Clear? All the concepts clear, beta. Coming to the next one. Yes, coming on the next one. A child with throat pain, fever is found to have a whitish membrane over the tonsil. Examiner giving a MCQ on tonsillitis. Very important topic. So let us rule out the option. What is a keyword in the MCQ? The patient, the membrane is bleeding. Membrane on removal is bleed. It means we go in the favor of diphtheria. If it is streptococci, it never bleed. If it is diphtheria, it bleed. Clear? So the answer will be C option, not A option. A option never bleed on removal. Diphtheria, very important topic. Let us summarize the keywords related with the diphtheria. One is your it bleed on removal. One is bull's neck. Patient having diphtheria is having bull's neck and having dyspnea, for which we go for which level? Tracheostomy. Low level tracheostomy. Why low level tracheostomy? Because diphtheria have a high risk of dissemination. So all my students will revise 3 MCQs with me. Which membrane bleed on removal? Diphtheria. Bull's neck related with diphtheria, and one is your low level tracheostomy indicated for infections who are having high risk of dissemination like your diphtheria. From here we have one more MCQ where is high level tracheostomy indicated, that is for malignancy. Very important point. Low level diphtheria, high level malignancy. Coming to the next MCQ, next topic on which the examiner can make the MCQ, that is tonsillectomy. They can ask you the definition of recurrent tonsillitis. What are the indications? So what are the 5 basic indications? One is your recurrent tonsillitis. They can ask you the definition of recurrent tonsillitis. So always remember, it is more than 4 episodes in the past. With a single episode of lymphadenopathy is recurrent tonsillitis. Malignancy is one of the important indication. Non-responding diphtheral infection, non-responding rheumatic fever, and one is long stellate process. Revise with me, beta. Again, 5 indication of tonsillectomy. Very favorite question of your examiner. Recurrent tonsillitis, malignancy, non-responding diphtheral, non-responding rheumatic fever. One is your long stellate process. These are the important indications. What is the most common complication? That is your bleeding, hemorrhage. Venous hemorrhage more than arterial. Venous more than arterial are responsible. Clear? That is your, which vein is will be responsible? Descending palatine. And which artery, that is tonsillar branch of facial artery. So these are important 9 to 10 MCQs related with tonsillectomy, tonsil, membrane, treatment of choice. Clear? Done. Coming on the next one, that is patient is having earwax, very important point. On nerve supply of external auditory canal. Examiner is asking you, he is doing the syringing, patient have syncopal episode, which nerve is responsible? Always remember that is your Arnold nerve, that is your 10th nerve will be responsible. And which area I am talking about? I am talking about anterior inferior. Anterior inferior is supplied by 10th nerve. Posterior superior is supplied by 7th nerve. That is your nerve of Wrisberg. We have all discussed all these points in the classroom. The 5th nerve is anterior superior, and posterior inferior is C2, C3 fibers. So answer will be anterior inferior for the cough reflex. If the examiner asks you Hitzelberger sign, what is Hitzelberger sign? Loss of sensation in the posterior superior part of patient suffering from facial palsy. So that is your Hitzelberger sign. Cough reflex is your anterior inferior, Done. Coming on the next one, very simple question. A child is having history of foreign body and X-ray is shown to you. What is the basic concept? Just remember, beta, we look for AP view, lateral view, AP view and lateral view. Just remember, on AP view, if the foreign body seems to be a circle, and on lateral view it is like on this line diagram, in the lateral view I'm getting a line appearance, that is the foreign body is in the esophagus. Just remember this point. If on AP view you are getting a line, and on the lateral view we are getting a circle, that is going in the favor of, that is your respiratory tract. It can be trachea. Clear? So answer in this option, lateral view. Just remember, beta, just remember AP view, a circle is going in the favor of esophagus, and lateral view it appear like a line. So in this condition it is a line on the lateral view. I will go for here esophagus. If this combination is given in IMCQ, on the AP view this type of appearance and lateral view the circle, then if the lateral view they are showing you some circle, that is your respiratory tract. Done. Clear? So answer to this question number 7 will be your option C, that is your esophagus. Coming to the next one, a 6-year-old child with a history of mouth breathing, high arch palate, failure to thrive and hearing loss. Hearing loss is there. Which of the following is the best management? School going kid with mouth breathing, adenoid faces, hearing loss, we are going in the favor of serous otitis media. An examiner is asking you what is the best possible treatment for serous otitis media. Now option A, B, yes, we will go for laryngotomy. We will puncture anterior inferior segment, followed by we will go for grommet, yes, and adenoidectomy. So what is the best answer? Best answer to this question will be your laryngotomy, will be your grommet insertion, will adenoidectomy. But now options D is much better option. Why? Because adenoidectomy and grommet insertion. So when you are putting a grommet, you are puncturing the tympanic membrane. So the word grommet insertion itself is including the laryngotomy. I hope you are getting the catch in the MCQ. If the students who have attempted laryngotomy, no, better option is D option, adenoidectomy. Why adenoid? Sorry, ET tube dysfunction. School going kids, most common cause of ET tube dysfunction is your adenoid. So adenoid is one of the cause. So we go for adenoidectomy. So answer will be D option. Where we put grommet and where we do laryngotomy is anterior inferior. Just remember this one. It is anterior inferior segment. Clear? Done. Answer of option question number 8 will be D option. Coming on the next one, patient coming to the ENT OPD with pulsatile tinnitus. Keyword already discussed in the class. Pulsatile symptoms, reddish mass behind tympanic membrane, nothing other than glomus tumor. Clear? So now I will use this option to teach you the importance of keyword like otosclerosis. So beta, if answer is otosclerosis, your eyes should be searching for a pregnant female complaining of hearing loss, red tympanic membrane, or they will give you some Carhart notch. Carhart notch, pregnancy, Schwartz sign. I will go for option A. Pulsatile symptoms, reddish mass behind tympanic membrane. I will go for option B. Congenital cholesterol, very important choice. congenital cholestoma. So what is the key word for congenital cholestoma? Keyword will be chalky white mass behind tympanic membrane in a pediatric patient. Pediatric patient, chalky white mass behind tympanic membrane is your congenital cholestoma. Last few days, beta, just focus on the keywords, and we promise you whatever we taught you in DAMS, more than sufficient. Just revise them multiple times. In last few days, no other source, beta, just focus on revision. Clear? Glue ear, serous otitis media. What is a keyword for glue ear? Glue ear will be your bulging tympanic membrane, like high arch palate history, some symptom going in the favor of ET tube dysfunction, school going aid, ET tube dysfunction, hearing aid, will go for glue ear. Even I have given the next MCQ dedicated to glue ear, serous otitis media. Clear? Last MCQ in this ENT segment, I will show you that image in next few minutes. Question number 10. A 14-year-old boy, very favorite question of FMGE examiner. 14-year-old boy, red mass, epistaxis, no other option going except nasopharyngeal angiofibroma. Option B will be the best choice. Nasopharyngeal carcinoma. What will be the presentation in option A? Nasopharyngeal carcinoma will be unilateral cervical lymphadenopathy. Patient will be having some mass in the neck. Clear? Inverted papilloma. Patient will be having whitish, not reddish. It will be whitish mass on the lateral wall. If it is whitish mass on the lateral wall, I will going for inverted papilloma. Rhinospodiosis. If rhinospodiosis, examiner will give you mulberry-like nasal polyp in a middle-aged patient, 40-45-year-old patient with a history of bath in the ponds. If examiner give you this typical history, patient having a history of bath in the ponds, we go in the favor of rhinospodiosis. Clear? So in this MCQ, answer will be your B option. Will be B option. Question number 11. Again a previous year MCQ. External contour of the nose is maintained by nasal bridge. It is formed by, that is your upper bony or lower bony. The basic concept of nasal cavity is my upper 1/3 is my bony part and lower 2/3 is a cartilage part. So upper 1/3 will be the bony and lower 2/3 is a cartilage, which is further divided into upper lateral, lower lateral cartilage. Upper lateral, lower lateral cartilage. Done. So answer will be in this MCQ will be your B option. Coming to the next one, a question number 12. A patient with suspected high frequency hearing loss. High frequency hearing loss means the base of the cochlea is damaged. 20,000, 18,000 hertz. Which of the following structure is expected to be involved? Helicotrema, not at all. Helicotrema is the apex at which the upper part of cochlea fuse with the lower part of the cochlea. It is very far away from the base of cochlea. If you draw the line diagram, this is my cochlea, and what is lateral to cochlea is my middle ear. So what is the basic concept? Basic concept is base of the cochlea is very close to middle ear. Any structure among the choices which is a part of middle ear close to the promontory, that will be the best option, like oval window. They can even give you the round window, that can be the option. Stria vascularis. Stria vascularis is the lining of scala media. Is a lining of scala media. This lining is responsible for endolymph secretion. So if my examiner asks you which of the following structure is responsible for endolymph secretion, I will go for option B. If the examiner asks you scala vestibuli fuse with the scala tympana, where it fuse here at helicotrema. So scala vestibuli fuse with the scala tympana at helicotrema. Answer will be option A. B option, stria vascularis is responsible for endolymph secretion. What is modulus? Modulus will be the right answer if examiner asks you which of the following structure the cochlea take a ton. So cochlea is taking 2.75 ton around axis. What is axis? Axis is modulus. Option D. Done. So answer in these choices will be option C, oval window. Question number 13 is one of the easiest MCQ. Typical presentation of facial nerve palsy. Patient with sudden onset of inability to open mouth, drooling of saliva, deviation of the angle of mouth. On examination, so the typical history of Bell's palsy given to you, but this is one of the easiest MCQ. treatment of Bell's palsy success rate is around 85% if you start the treatment within first 3 days. What we start? We start steroid with the antiviral, that is acyclovir. So always remember, if we start steroid and acyclovir within first 3 days, the success rate will be around 85%. Which part of the facial nerve is commonly involved? It is labyrinthine part, which is commonly involved. Done? Clear? So answer will be in this question, option C. Coming. So dear students, coming on the next MCQ, adult male with having dinner suddenly become aphonic. Very old MCQ, the patient is having foreign body. So foreign body, the best option among the given choices will be your Helmich maneuver. That is the best option for a patient who become aphonic, having choking sensation. Clear? So it is a food bolus which can be removed with the help of this simple Helmich maneuver. Coming on the next one, question number 15. A 6-year-old child bought by the mom with a history of hearing loss in 1 year since last 2 months. Very important slide given to you. What are these? These are blebs, beta, BLEBS, blebs. So just make a golden rule. If the word blebs given and if hearing loss is there in the MCQ, it is going in the favor of serous otitis media, that is your glue ear. Clear? Serous otitis media, glue ear. And if the word pain is mentioned, yes, we have discussed this point in the class. Pain with blebs over the tympanic membrane, it is your meningitis bullosa. It is meningitis bullosa. And if hearing loss, we go for serous otitis media. Just remember, even we have pain in the serous otitis media, but in case of meningitis bullosa, hearing loss will not be the presenting symptom. The presenting symptom will be your pain. In case of serous otitis media, it is your hearing loss. So among the given option is A. And already we have discussed the management part. What will be the management? That will be a maryngotomy, anterior-inferior grommet, anterior-inferior with adenoidectomy. Clear? So thanks all the doctors for listening to me. And just in the last few days, very strong message, beta. Be confident. Don't waste your time here and there. Just work on your class notes. We have given you all the workbooks. You just revise them thoroughly, beta. I promise you, touching 200 will not be a big challenge for you people. Just focus on the revision part. You can ask me all the queries in my Telegram group, on my Instagram. Clear? So thanks a lot again for listening.